Hello and welcome back to GP Video Podcast by Nadia. So, my beautiful audience, what I have decided is that I have noticed, and I'm sure you guys have noticed as well, that when I cover a topic and I make a few parts on it, what happens is I don't try to do it, but because I'm a bit OCD about whether the listeners who are listening to me have seen or listened to my previous parts or not. So what I do is I try and repeat myself for the topic from the beginning, and this actually takes a lot of my time. And what I usually end up doing is not giving much information in my next video. So for example, I'm repeating 80% of the time what I have already told you and just do 20% new. So what I have decided is from now on, I will be covering every topic in points. So for example, we are continuing with menopause still in this video, but I will be talking about 5 points in this video, and then I will try and not repeat those 5 points in my next video. So I'll give you 5 new points in my next video about either the same topic or any other topic. So let's start then. So the 5 points that I'm very precisely going to shed light upon for the topic of menopause in this video are: number one, hormonal profile is usually not of help. So women come to me all the time, and I'm sure come to the other GPs as well, and when they are suspecting that they might be menopausal, perimenopausal, they ask for hormone profile. Now, I have been doing them, and I have personally seen this, that hormone profile is usually of no help. What we do is we do reproductive hormones like FSH, LH, progesterone, and estrogen. And menopausal range has got, like, for all these four hormones, there is a menopausal range. So what usually happens is two of the hormones are in menopausal range, while two of the hormones are clearly not. So I get puzzled, patient gets puzzled, and we are like, okay, what is it? What do we make of it now? So basically, menopause is, or perimenopause is, very much based on the clinical diagnosis. It is usually a diagnosis of exclusion in which we try and exclude all the other causes. Like if you are chronically fatigued or you are gaining weight, we check your thyroid levels, again iron levels, again hematology, your liver, your kidneys, and all B12, vitamin D, all that kind of stuff that we do. And then when we don't have any other cause or any other answer to the cause of the symptoms, we say that yes, because as I have said, that estrogen receptors are all over the body. So brain, heart, cardiovascular system, gastrointestinal system, bones, everywhere. So any kind of symptoms you can experience in the perimenopause period. So usually hormone levels are of no use, and if your GP doesn't do it, doesn't matter, it usually is going to puzzle you more. So it's going to be based more on the clinical symptoms. And as I said, that in perimenopause period, levels are going to be high, up or down. So you could have very high estrogen levels and you were like, okay, I'm not in menopausal period, while you are perimenopausal. Or some women who are already using contraceptive, like have Mirena in place, or are doing combined oral contraceptive pills. Again, you're not going to get any true answers because you're already on external hormones. So again, the thing is that hormone levels are not reliable at all, and usually should be avoided to do or to diagnose perimenopause. That was my number 1 point. Hormonal profile is usually of no help. Number 2, estrogen is the main treatment, where progesterone is to keep uterine wall smooth and trim, as estrogen makes it thick and progesterone thins it out and prevents uterine cancer. So again, my point number 2 is that if a woman has uterus, she needs both estrogen and progesterone as hormonal therapy, and if she doesn't have uterus and has got no history of endometriosis, then only estrogen should be given. Number 3, best way to do hormonal therapy is to put a Mirena IUD in, which releases progesterone only, and number 2, estrogen patch. So estrogen through the patch and progesterone through Mirena IUD. But if, sorry, my video was interrupted. So what I was going to do is Mirena IUD and estrogen patch. But if women don't want to do IUD, which is sometimes can be inconvenient, then we can do a combined estrogen and progesterone patch. So that's the best way to deliver hormonal therapy. Point number 4, average age of Australian women to get menopause is 51, while the actual normal age range is between 45 to 55. Any menopause occurring Below 45 is abnormal, and what is it called? What are the causes? I'll talk to you about that in some other video podcast. Number 5, your periods can be quite heavy, they can be quite light, and they can vary in between. Sometimes very heavy periods, then for 2 to 3 months nothing, then light periods, then again heavy periods. So periods can be all over the place in perimenopause period. So don't get worried about it. 5 points again. Hormonal profile is usually of no help. Estrogen is the main treatment, while progesterone is to just trim out the uterus. So with people with uterus will get both estrogen and progesterone. People with no uterus will only get estrogen. Number 3, best way to do is Mirena IUD and estrogen patch. Otherwise, a combined estrogen and progesterone patch. Anywhere between 45 and 55 is normal, with the average age being 51. Anything below 45 is abnormal. Number 5, periods can be quite heavy, quite low, and can vary between, as hormones are all up and down. Catch you next time.